Today, we've been talking about repetitive actions and rituals that are part of OCD and how those can disrupt normal life. Now, in Melissa's case, it has become so frustrating when she's around her sister Justine. But I want to talk about OCD some more, so I invited my good friend, Dr. Frida Lewis Hall, Chief Medical Officer of Pfizer, to join in the conversation. So welcome.
Thank you.
From a medical standpoint, explain OCD.
Well, first of all, let me say it disrupts every aspect of life. Yes. What causes it, we're not certain. It can run in families, so we know there's genetics at play, but there are also biologic and environmental factors, and likely a combination of those things that are the cause.
Right. And so let's talk about the dangers of OCD, because we saw some of the things with Melissa and how it disrupts her life, but let's talk about some of the actual dangers.
There can be some really serious consequences to OCD. Three things to remember. First, OCD is often complicated by the fact that it coexists with other illnesses, anxiety disorders, depression, and other mental illnesses. Second, a complication is that many patients go on to self-medicate by using alcohol, drugs, or both. And then third, last but absolutely not least, is that people with OCD are at high risk for suicide, and especially if they also suffer with depression.
Now, earlier in the show, we had Melissa who started showing symptoms of OCD at an early age. Why is that important, this onset time?
I'm so glad you asked that. You know, statistics tell us that 2.2 million adults in the US suffer from OCD. But it's so important to know that in many cases, this disease starts in childhood or in the teen years.
Right.
And so what should parents and caregivers know? They should be vigilant in recognizing the signs and symptoms of OCD and then bring those things to the attention of their healthcare provider. And that's especially important because OCD is a chronic illness. Early detection and diagnosis is really key.
What are the best tools for managing OCD? If it's diagnosed, you know that it's there.
So again, this is a chronic illness. We're looking to manage it. And there are a number of tools and treatments that are available. One that's really important is cognitive behavioral therapy. This is that therapy that helps people challenge their thinking and their actions or their behavior. There are other therapies that are used and medications that are available, and often these things in combination are used to help manage. Right. And of course, information, as always, is the key. So for people who want to know more about OCD, they can go to gethealthystayhealthy.com.